Hi, I'm Meredith Nathan. I'm the Director of Massage here at Pulling Down the Moon, and in honor of the recent blood moon eclipse that we just had, I wanted to show you some blood building exercises that you can do at home to support your reproductive health. Now, these techniques should only be used in the follicular phase of your cycle, so that's before ovulation or transfer IUI or before your trigger shot as well. Should not be done after any of those points if you could be pregnant. So with that, also let's talk for a moment about your circulatory system as it relates to your reproductive anatomy. There is an image that is attached to this post that you can look at for reference to show the way that the blood travels down the body. So blood travels down your abdominal aorta and then branches off into the iliac artery and then down the femoral artery, but from the iliac artery it branches off into the uterine arteries, which then do connect to the uterus. Likewise, coming down from the aorta, your ovarian arteries branch off to supply blood flow to your ovaries. So knowing this, there's techniques we can do to encourage an increase of blood flow to both the ovaries and the uterus. So let's start with that ovarian blood flow technique. For this technique, you're going to want a little bit of oil. If you have massage oil at home, that's great. If you don't, you could use olive oil or really anything, a lotion, anything that gives you a little bit of slip. So I've got a massage oil right here. I'm going to put a little bit in my hands. And this is a very simple technique. Just going to lift up a little bit to show you. So I'm going to come underneath the rib cage here. This little area, it's called your xiphoid process, but right underneath that. So I don't want to be on the bone, but directly underneath it. I'm just going to go ahead and do strokes downward toward the navel. So I need a little bit of that slip to be able to get it, but I'm just going to do this slow, repetitive stroke down from right below the rib cage to the navel. I am applying pressure, but I want to make sure it's comfortable. So as I do this, I'm just encouraging blood flow down the abdominal aorta, where it's going to then supply blood to the ovarian arteries as well as the uterine arteries. So that's one technique. I can do this 5, 6, 7 times, up to 10 times. And you can perform this several times a day. It's also kind of relaxing as you do it. A second technique that we're going to do will work the opposite direction. So as we talked about, blood flow is flowing down the abdominal aorta, down the iliac artery, branches off to those uterine arteries, and then down into the femoral artery. So we're going to actually work now starting at the femoral artery and create a backflow of blood. It's almost like we're creating a temporary dam right here, so that blood has to kind of flow back up temporarily to the uterine artery, to the uterus and ovaries. So we have 2 tendinous areas right here on the leg. We're going to come in between those 2 areas. We're going to be close to the bikini line, but not directly on top of the bikini line, so a little bit below the bikini line. And we're going to apply a slow pressure down there, and you want to stop when you feel a pulse. So that femoral pulse, if you're on it, should be fairly strong and noticeable. So once you find that spot, you can go ahead and hold that for 30 seconds. You can then release it. You can hold again for 30 seconds, release it, and you can hold for a final 30 seconds. The fire department is very excited about this as well right now. So basically a total of 90 seconds broken up into 3 parts. You can do this on both sides, and you can do that technique up to 3 times a day to help create that backflow of blood, to help supply more blood flow to your reproductive organs. So with that, again, in honor of the blood lunar eclipse, we hope you have a wonderful day and enjoy your blood builder techniques for fertility.